when you're losing weight with combined weight training versus losing weight and you're not doing weight training. Shrinking in size but getting softer is not pleasing to anybody. Like, it's just the reality of the situation. And shrinking in size but seeing the firmness, the tone, like when you see your first vein pop out somewhere, it's, oh my gosh. And I'm not saying you guys want to get veiny, but you get my point. It really is exciting. And no one's ever complained about a toner physique. Are you running into any struggles? Let's really start there.
I'll go first.
Okay, awesome.
I went to the gym, and I do wall Pilates usually, but I went to the gym and I just started working the machines. And then I went out of town for the last month. And where I went, it's a small town near Canada. There was a professional trainer there for $30 a session. So I started going to his gym.
That's a good
Yeah,
deal.
and I
That's
did
not
that.
bad.
Yeah, it's great because he does small groups, but like it's new, so no one was showing up but me. Yeah, so I did 2 to 3 sets a week. And then now that I'm back, I just got back yesterday, back to my where I live. I can just take that to the gym.
Nice. Nice. So you got
And then
a heck of a lot more.
I have some trainer friends too. I forgot. I have a couple friends who are actually trainers, so I might ask them for some tips too. But now I have a workout regimen. So I guess that's how it's been going for me.
Awesome. So it's been going great then. It's been going good. Like, you were able to get
Yeah.
some because it's always, even for me, if I have someone there pushing me, it's going to be harder, even though I know how to work out really hard. There's still that aspect of someone staring at you saying, no, you keep going. Ugh. But the biggest thing for you guys is just for anybody new, it's really understanding I think the biggest roadblock, you get a couple weeks into it, is the pain, right? You feel pain when you lift weights. There's pain. And it's like, how do you keep doing something that's hurting? Identifying what is the good pain and what is the pain that we're trying to avoid, which is the muscular fatigue. That's the acid, which is the byproduct of the muscles producing the energy to move the weight. And feeling that and experiencing that and being able to take that to the literal end range, and also avoiding joint pain, right? I think that's like the biggest struggle for anybody. And there is an aspect of that does get better over time. Over time, you get more used to it physically, you get more comfortable and used to it mentally. And in the beginning, it doesn't have to be such a torturous thing. But after a couple weeks, after a couple months, you do want to continue to push yourself through that. And it just becomes second nature because, like I said before, soreness is what you want. You don't need debilitating soreness, but you do want muscle soreness, which does tell you effectively were able to really get into some micro trauma into the muscles, which it's that micro trauma, that soreness, which is going to be responded to by the body with positive adaptation. Now, ultimately, that adaptation, if you want muscular growth, would require you to be in a caloric surplus, would require your protein's always going to be high enough. But if your calories are not in a surplus, you're not going to put on substantial muscle, as you guys know. But the goal is to protect that muscle mass as much as you possibly can. So that's awesome. Thank you for sharing that, Scarlett. How's the weight training going for everybody else? Who's succeeding? Who's struggling? Who's still not doing it yet? And it's okay. We're all in this. iPhone 4. Who's that?
Is it Lisa?
Awesome. So how's it going then? I wasn't sure which category you were putting yourself in there.
I have not started yet.
Okay.
Work right now is really crazy. We're getting ready for our county fair. I'm working between 55 and 60 hours. And I did join the Y, but I just haven't gone.
So you made motion, you joined. What do you think? Do you think if you took a step back and said, next week, let me just get in one time, do you think maybe the idea of the fact that 3 times a week doesn't seem realistic the next 2 weeks, so your mind's just, I'm just not going to go? Because that sometimes happens. That does. So what if we just said 1 time a week next week?
And that's actually my mental. I'm like, oh my God, I don't have to do this, but I could have gone once this week.
Yeah. And I think that is the human sort of reaction, that if you do set up a structure and you realize you can't do the full extent of what you planned, then there's this kind of like check out, I won't do it then. It's really easy to slip into that and get busy. So I think let's just for this week, let's take a step back and say, okay, I'm going to get in one day. So I want your target for yourself here to set up. We could just set it up right now. Realistically, next week, what is the most likely day that you can get in just one day? One day. So let's do it. Let's put it in your calendar. Let's get that set up. If you can do more, which by the way, probably will happen because you're going to feel good. You're going to like the endorphins. You're going to feel accomplished. And because there's always, it's a dopamine thing. It's a motivation. It's a target. There, Mindy Pels talks a lot about this with fasting and how fasting improves dopamine sensitivity, which is nice. Dopamine is that motivation neurotransmitter, that dopamine, that motivation brain chemical, which we need. And we lose sensitivity to it. We lose numbers in the neurotransmitter. So as we start to set targets and hit them, that gives us a dopamine hit. Much more dopamine hit of saying I'm going to go once and hitting it once versus saying I'm going to go 3 and hitting it once. Because if you say 3 and you hit it once, then you feel a little bit like, oh, I failed. So sure. Yeah, of course you want to make it 3, obviously, because that is the goal. But for you, we're adapting, we're modifying, we're going to lower the target, hit that, and then go out from there. So thank you for sharing that. I think, yeah, let's get that session in. Let's do a full body session. And to the best of your, and you already said you know what to do when you get there, right?
Yeah.
Perfect. Awesome. So I started before vacation, and since I got back, I haven't got back to it. That happens. That does happen. You go on something, whether it's a vacation or you just have a bad week, and then all of a sudden you're like, okay, great. And then now you can't slip back into it. Yeah. So the same approach, I wouldn't necessarily downgrade it next week because it's only been 1 week, right? You've only been off your game, right? You've only failed to accomplish your normal target. So I'd say next week you feel confident you're going to get back to it. Boom. 2 to 3 weeks of, for some reason, failing to get back into it is when you could maybe take the approach that we just talked about, which is lowering the target a little bit so that we can get a hit. But in your case, I think you sound pretty confident you're going to get back to it. So I just would set that, accomplish it, get back to your rhythm, and then you're back at your rhythm. So I think that's what we should do there. Jen G, not lifting yet, walking 3.5 miles. Okay, great. So what do you feel like, Jen, has been the roadblock for you that's keeping you from really starting?
I think for me right now is time. I'm renovating a property. I work 50 hours a week, and I'm actually at the property right now, which is why I don't have camera and I've been muted because there's a bunch of stuff going on here. Totally. I'm running from room to room trying to dodge people.
Totally. Now, how long does the walking 3.5 miles take you?
About 45 minutes.
Are you working during that time? I'm curious because
I figured. I should not be working. I should not be walking, but I am. So don't call my boss.
I figured if I was going to say replace the walking with lifting, but if you're working, then I get it. What do you think? So setting a lower target like than 3 and just saying 1 workout, when is a realistic target to be able to get 1 workout in and just go like starting somewhere?
I have personal weights at the house, and I've done it at the house before, but I think I keep hearing you say lift heavy, and I feel like just doing the dumbbells, the 20 and 50, I have a 50-pound kettlebell or 40-pound kettlebell, and I have 20-pound dumbbells, and I have 10-pound dumbbells, but I feel like that's not enough. So I'm just like, if it's not enough, I should be lifting heavier. I probably shouldn't even bother.
Totally. No. And that makes a lot of sense. So I'm glad you're bringing that up, and everything has to be considered in context. So I do say that a lot of my TikTok lives and getting people riled up on those things too is a little bit different than you guys get a lot more in depth. So yes, the target, the goal, the eventual place we need to be at is a structured, progressive regimen of workouts with machines or really good TRX bands or something where we're really bringing the muscles to failure, hitting all of them. That's the eventual thing. But to really give context to this, if you're doing nothing right now, absolutely doing anything right now is better than nothing. It really is. So we have to remind ourselves that. And it would be actually extremely important to get something in. So in the beginning of your weight training program, or if you've been out of it for several months, there's this sort of like shock to the body where it responds pretty quickly. First couple of weeks, whatever you do, you're going to get a nice response. So just keep that in the back of your mind. After a couple of weeks, that's when you got to start cleaning things up a little bit, start getting more progressive, start increasing the intensity, increasing the volume, really structuring it in. But for you right now, as busy as you are, not doing anything, let's just get what you got and just roll with that. I would rather be dealing with the problem of 6 weeks later, you're still only doing that, and me trying to say, okay, let's get to the next level, rather than 6 weeks from now, you're still where you're at now, having not started. You know what I mean?
Right, because the 8 of those extra 12 hours of sleeping, so that made it easier. So,
yep, yeah, same concept. Did you wake up hungry that morning?
no, I talked to my regular doctor today about just a regular checkup, and she's shocked that I've never gone over 0.25 on my, and I just had my 9th shot, I believe.
Yeah.
And because I guess she does have people that are on Manjaro or whatever else, and that are on much higher doses than me. And I have been consistent with a 0.25, and I've not been hungry yet.
So she is going to be shocked. And this is, I was listening. Thank you for sharing that. And actually, let me answer your question before I tangent on something that I got to share with you guys, because it's important. So the concept of trying 236s was in response to the flow fasting variability. So not every week, your base, guys, is 48, if that's working for you, till we hit to our weight loss goal. After a couple months, though, we want to start switching some, I call it flow fasting variability. So you just did a long fast. That's you're good. You just shocked your system. So I'm okay with you going back to 48 for a couple of weeks. And then about once a month, I think, is a good amount of time to then switch it up again. So in a month from now, if we're still in the weight loss goal, the weight loss portion, that's when you can add, for example, say 236s in a week. Does that make sense?
Okay. Yep.
Yeah. So I would definitely not go straight to that.
I just thought it was straight. I just thought you meant when we talked the other day that it was the 60 or longer, and then the next week go 99 or 6 or 36. So
yeah.
So I'll go 48 for the next 3 weeks, and then the next one I'll do the 36.
Exactly.
Okay.
So let me get this point, and then I'll get to Don. or Scarlett, and then we'll get to Don, because Scarlett asked earlier. I'm so glad you said what you said right now, because I was listening to an obesity specialist, and these men and women are so programmed to follow the research, which you're supposed to, right? That's why research exists. I'm not saying to invalidate research, but they're unable to think logically outside of the data now. And it's so crazy to me. And obviously it must be easier for me, from where I'm coming from, to embrace something outside of research, because that's what I've always done. So I could appreciate that it's much easier for me, but I still have a hard time understanding why it's so difficult for them, most of them, to think of anything outside of what the data shows. But to your point, your doctor was like blown away, because she's like, what the heck? Like, you're getting great results and you're at 2.5. My patients, I've never seen that. Oh my God, maybe there's something more to this, right? But the majority of them it's just the reality of being a practitioner in that space that is heavily indoctrinating them with this approach towards medicine as a whole, where and I made a video about this the other day on TikTok. I don't know if you guys saw it, but I made this little 3-minute video talking about how a lot of research is heavily biased, especially with the financial influence, but also even outside of the bias of research is this concept that before, like, a lot of people, not just doctors, operate off of, if it can't be proven to be true, it must be false. And I used the germ theory as an example, because we didn't prove germs to be actually, like, did we accept the germ theory wasn't until mid 1800s, when we talked about it from the 1500s, and we continued to blame bad air from the 1500s. This is actually true, bad air, as opposed to germs, even though we knew it was there. So it's just, I want you guys to understand these fallacies that exist, because, as I also stated in that video, I'm not suggesting we abandon research. Never do I ever want to portray that. We've gotten as far as a society as we have due to what research has been able to do for us. So we have to respect it and appreciate. I just want you guys to be able to also consider possibilities that may be contradictory to what we think the research is telling us. That's all. Open up your eyes, open up your ears, realize that there's a heavy agenda behind the majority of the research we get. There's a heavy financial influence from a lot of the nutritional studies that we get that are funded by big food companies. And you guys might find this shocking, but 70% of the funding for the medications that were released from, I think it was 95 to 2020, 70% of the funding for all the research was funded by Big Pharma. You're going to tell, how the hell is that even? And we're supposed to just trust that? So just, again, guys, this is, I think the takeaway, like I said, is just keep your eyes open, keep your ears open. Research is great. Realize there's always an agenda. And I'll do my best to keep you guys, I'll do my best to keep you guys aware and abreast to what's going on in the holistic space. So
I have another thing about what my doctor
charge.
what my doctor said as well.
Yeah, for sure. Tommy, if you
she-
want to give yourself a mute real quick, go ahead, Mark.
Yeah. She also said that she is not seen, and now that she's been prescribed Manjaro and all this other peptides, that she has not had one instance, and she says of thousands and thousands, I don't know if she's talking to herself or her practice or whatever, no one's had pancreatitis from this either.
Yeah, we have had maybe two, and I wouldn't even say pancreatitis, just elevated enzymes. And elevated pancreatic enzymes is, we're progressing towards that. But I've had one patient with some pain that we thought was pancreatitis and it wasn't. But yeah, I'm glad you're bringing it up. It still happens, but it's the point from that, the takeaway for me is it's very rare. So
That's what she said. Very rare.
Yeah. So I agree with her on that, actually. But thank you for sharing that, Mark. Scarlett, I feel so good in my body since I started the weight training part. That's freaking awesome. Before I was exercising a lot. Can't wait to hear about. Yeah. Oh, you were just commenting. Yeah, no, seriously, it is a huge difference when you're losing weight with combined weight training versus losing weight and you're not doing weight training. Shrinking in size, but getting softer is not pleasing to anybody. Like, it's just the reality of the situation. And shrinking in size, but seeing the firmness, the tone, like when you see your first vein pop out somewhere, it's, oh my gosh. And I'm not saying you guys want to get veiny, but you get my point. It really is exciting. And no one's ever complained about a toner physique. And if the aesthetics aren't enough motivation, there's plenty more that I won't bore you guys with about how important for our metabolic health and longevity muscle mass is. Fantastic. All right, Dawn, go for it.
Fasting question. It's really easy for me to go in like past that 48-hour windows. Is it harmful to go into that 60 to 65-hour window more often than once a month?
It can be. Yeah.
Okay.
The only problem that I've seen is beyond 48 for most people, if we're talking continually, weekly, for example, is to not plateau, to not get that response from your body where it thinks, oh my God, I'm starving and let me turn down the metabolism. In theory, I would think, and I haven't been able to run this test, would be if you made an effort to eat even more on the 4 days now, right? Including one, and you would probably need a day and a quarter to break that 3-day fast. So now you're really left with less time. But in theory, if you ate a high amount of enough calories on those days with enough protein, you would get even better results. But trying to get people to do that is obviously problematic. So it's the same kind of concept with OMAD. OMAD would be great in theory if it was ran right. You'd have to, with that one meal, you'd have to ensure enough calories and enough protein. But if you did do that, OMAD would be phenomenal. So
yeah, I don't know about upping my calories and protein on the other days, but it doesn't take me a day and a half to break it. Like when I've done it in the previous, like I did it last week or the time I did it like a month ago when I was like, oh shoot, it's 8 o'clock, 9 o'clock at night. I'm not going to eat. I'm just going to push it till tomorrow. So I end up breaking my fast around 1 o'clock on Saturday, which is about when I break my fast normally. I don't have a hard time with like gut issues or anything like that. I can eat my normal day's worth of food on the Saturday that I break my fast.
Oh, nice. Not immediately with the first meal, but with
like I ease it in. I'll do like a protein shake or something or a bone broth to begin with, and then have an actual lunch or something an hour later. But I get all of my the same amount of food and meals and stuff that I would get in on that day. It doesn't take me like all day to break a fast.
Nice. Yeah, ultimately, because the majority of what we're doing here is not backed by research, right? Like I'm speaking with you guys from just anecdotal observation and experience, but because it's not so controlled scientifically, there's a lot of experimentation. That's why I said to you, if you want to do that, I'd love to see what happens if you can increase your calories and protein. In theory, that could really hit you to the next level of fitness. You just got to make sure you do that.
Yeah. I did it for my fast last week was like 64 hours or something. And so maybe I'll try it for a couple of weeks and we'll just keep an eye on it. Cause it's super, I don't break my fast till dinner time anyways. And I'm like, I'm not really hungry. So then I got to figure out how to like ease my fast in, but it's close to dinner time. It's just as easy to wait till the next day for me, actually.
Nice.
So,
oh, that's awesome.
Okay.
So even the most healthy individual, primed optimal on every category of health, is going to gain weight when they consume more carbs. Let me phrase that perfectly. If you have a little bit of carb depletion going on and you eat carbs, you're going to gain a lot of water weight, a lot relative to how much more, right? So if your carb reservoirs are maxed out, then in theory, the extra carb just gets converted into fat. So not as much of a change. But if you are coming out of a little bit of a keto or a little bit of a fast or a little bit of a calorie restriction, all of those will cause some amount of depletion of your glycogen stores in your muscle and your liver. So therefore, there will be weight gain that seems high, but a certain percent of it is just water. Now, there's also a glycogen top-off kind of concept, meaning where you're at max, but your body has this extra little bit. And what could tap that, and this is what bodybuilders do right before a show, is they go super crazy with the carbs because there's a reaction where your body goes, oh shoot, this is insane. This is so much. Let me tap into the extra space, and they get that extra swelling effect of their muscles, and it makes it look even pumped. So if you're eating normal amount of carbs and then all of a sudden just out of nowhere you have this crazy higher carb day, even when you were at the normal full, you're going to have extra water storage. It has nothing to do with insulin resistance. It just has everything. Yeah. But yeah, no, for sure. That's a great question to clear that up. And then the other part of it we have to understand is inflammation. So inflammation is its own beast. And what you're eating, as you guys know, we've talked about processed foods versus unprocessed. The more processed, the more inflammatory. But the biggest determinant of whether that meal, that potentially inflammatory meal, is going to really throw you off and cause you to get indigestion or bloating or any of these kind of potential things is your body's situation, where it's at. For example, somebody that has celiac disease is a great example to give you. It's an extreme example. A person with celiac disease eats any amount of gluten, like even breathes it sometimes, and they get wrecked. So very
4 pound overnight on the scale.
Yeah.
4
Is that you,
pounds
Don?
immediately in inflammation. I've not been diagnosed celiac because I won't eat enough gluten for them to do the test with me having gluten in my system. But gluten wrecks me so bad that I just eat as if I am celiac. And if I do accidentally get it, it is an immediate 4 pound gain on the scale, pure inflammation.
Gluten is, a lot of functional practitioners just say everybody should go gluten-free. You never will hear me say that. I'm not opposed to getting to that point at some point. It's tough, right? Because it's tough for me to want to say that because I've had so much success with people eating gluten still. But from a functional perspective, they're thinking like, how can I get this person's body as healthy as I possibly can? Well, cut out the gluten. I've seen functional doctors, I've seen improvement in everybody. But I'm thinking, okay, weight loss, sustainability. Can this person adhere to a gluten-free diet? That's really challenging. Kudos to you, Don. It is challenging, right?
It's a lot easier now. So I've had gluten intolerance way before gluten-free was like fancy. So I've been gluten-free for like close to 15 years. It's a lot easier now than it was 15 years ago. A lot easier now.
No. Oh yeah. Cause there's a lot of gluten-free products out there for sure. I could imagine. 15 years ago it was brutal. So everybody could benefit from trying a 3-month gluten-free diet. And truthfully, rather than doing a test to see if you should do it, you should just try gluten-free for 3 months. And we're going to hit a point here where I told you we're migrating to a new system. I'm going to have a lot more flexibility with these courses and start giving you guys more things like, hey, if you want to try this, you could try this. One of the things that anybody could try, and for you guys, I would say 2 to 3 months into the program, because you got enough on your plate with starting this, but you're getting closer to your goal. You're 2 or 3, 4 months in, you're feeling good. Everything's going great. You're in autopilot mode. Yeah. If you want to try a 3-month gluten-free diet and see what happens, see if the reward to your body is worth the effort it took for you to do that, by all means. The people that we know have to adhere to this are the celiac, specific autoimmune cases. There's no discussion. You have to. Other people, like I said, you're getting some amount of inflammation from the gluten, but we're doing enough other things like the fasting. Remember, the long fasting, that's another powerful thing about long fasting. It is powerful at cleansing and clearing out that inflammation. I honestly think we get away with not having to be as strict in our food with the FLOA protocol versus doing the exact same thing, but with less fasting. I think you get this sort of like opportunity to eat worse, although that's not what I want you to do with it, but you get my point. It's nice. But anyways, yeah, no, that's great, Don, that you're able to adhere to that for sure.
The consequences of not is not worth it.
Yeah,
it wrecks my gut. It's no fun.
Yeah, because you've done that, right? Going back to Tommy, you got the glycogen water top off, and then you got the general inflammation that can happen from food. People can have food sensitivities. There might be certain foods that you react to as well. Very likely what you're describing is more of an inflammation thing and less of an insulin resistance. Insulin resistance is not something that you're going to feel like that in terms of inflammation. Insulin resistance, we test for it if we wanted to test for it with a fasted insulin or C-peptide test, but anybody who's more than 20, 30 pounds overweight is insulin resistant to a certain degree. So we all have it if we got some fat, excessive levels of fat in our body. And some people have it much worse, like pre-diabetics and diabetics, or if you have skin tags, or if you have lower levels of energy, belly fat, although those can have differential diagnoses as well. These are the things that also play into insulin resistance. So I definitely wouldn't worry about it, but I wanted to really cover that in depth. So
thank you.
Yeah, absolutely. Savi, I have not been able to start on my tirzepatide yet since I've been struggling with staying consistent with my calorie intake. When I was instructed to count my calories, I was consuming about 2,000 a day, but I am now only able to hit 1,500. Should 2,000 calories still be my goal? So let me make sure I understand you, Savi, because I know you just started recently. We started off with you counting so that you can figure out how much you needed to consume, right? Because we didn't know how much you were consuming, correct?
Yes, but I think maybe those few days when I first was counting calories, like for some reason I ate way more than I normally do.
Gotcha.
So yeah, ever since then I've been able to like stick around like 1,500 calories.
Yeah. So then I would continue to, like, you need to be increasing that. If you feel more accurately that 12 to 1,500 is probably a better representation of where you've been at,
Yeah.
then you got to do a reset. We got to get you back up to 2,000-ish, somewhere around there. And we need to stay consistent with that. So I'd say probably, like you said, next week, let's target, if you've been 12 to 15, let's make your next week target around 15.
Okay.
Fantastic. And yeah, starting tirzepatide when you're in a reset, kind of pointless. So yeah, just keep that ready for when you need it after the reset.
Okay.
You could start a microdose too. So you could do a very low dose of it just to, I would say, let me ask you this question. Are you struggling to eat more right now? Or is it just more, what do you think the roadblock is to eating more?
I naturally don't eat like the first time I eat is usually around noon or 1 o'clock in the afternoon, just because of my work schedule. And then I don't eat for the rest of the night. So I already do an intermittent fasting. So I feel like during that time frame, it's just what I'm eating. Like I'm trying not to eat bad. So a lot of stuff I'm eating is low in calories anyway.
Gotcha. So it's not like it's not a lack of hunger issue, and it's not like you're feeling like you're having to force the food down. It's just more kind of being used to it. Is that correct?
I think so. Yeah. It's more like my body's just used to that at this point.
Totally. Yeah. Adding a microdose can start improving the insulin sensitivity, which is nice, but it might also make you a little bit less hungry too. It's probably going to do that. So if you want to wait, that either scenario, there's no way for me to say what's going to be better. But if you're feeling antsy and you want to give it a shot, I would go really low on the dose. Definitely your decision on that.
Okay. In the meantime, is it okay to take the AOD?
Yes. AOD is awesome. The sooner you want to start that, the better. It's very powerful at what it does, which is mobilizing the body fat, starting to work on the metabolism. improving the metabolic flexibility. AOD is great. Just keeping in mind you might have to buy more a little bit sooner. So definitely your choice on that.
Okay. Thank you.
Fantastic.
I have a question. My TDE is pretty low because I'm only 5'1", and it was like 1,420 calories on my sport tracker or whatever food tracker thing that you had us download. And so I've been going under like around 1,200, maybe even 1,040 sometimes. And then when I went out of town, I realized I was going to start to plateau. I could feel it. So then I ate more. Now I'm going to check myself. I'll weigh myself in a couple days and I'll check it. But so you would say definitely under 1,200 is way too low. Because I'm I'm short.
Are you sure? Yeah, but height is only one of it's height, weight, gender, activity level.
Okay.
So I'm wondering if you were looking at the right number. Were you going to the TE calculator on Google?
I did that, and I also did another one, which was the basal metabolic rate.
That's
and it was
different.
still okay. So I did the TDEE, and then I think it was around 1,420. And then I also did the one for the calorie tracker, and it was around 1,420. And then I did the basal.
Yep.
And I feel like that was a little more for some reason.
Yeah, I think
Maybe.
you might be mixed up on the numbers. Go to the one on Google, do that one again. Your TE, let us know if it actually does say 1,400 because something seems off. Usually the lowest I've seen is like 1,600-ish, 1,700-ish.
Okay.
You'd have to put 0 activity level. So I don't think that's the case. So go check that again. TEE is the larger number, BMR is the smaller number, and you are trying to go into a deficit from your TEE. That's what we're trying to do.
Okay, so I'll check. Sorry, I thought it was TDEE. Okay, so I'll check TEE and I'll let you know. But even when I was thinner, I didn't eat a ton. So I don't know. But that was when I was thinner. I'm not thinner. I'm not thin right now.
Well,
Obviously.
and you could have just been under eating the whole time, which is the thing that a lot of people do, mostly because of GLP-1s. But sometimes people come to us and they just weren't eating enough for whatever reason. Their body just was hormonally not getting them to eat as much as they should optimally. And then we get them eating more and they're like, oh my gosh, I didn't realize this is how much I should be eating. You should be eating when you're not trying to lose weight as much as you can. That doesn't cause weight gain. That's that's what you're supposed to be eating. Now, I think it's better for humans to come in waves and to have that fast and feast like balance instead of just a static caloric intake. Because when did our ancestors ever eat the same amount every day? But maybe on a weekly basis, having some sort of balance.